Hello, I'm Dr. Robert Tufts. I'm the Medical Director of the Beverly Hospital Sleep Disorders Center. I'm also the Chief of Medicine at Beverly Hospital. I've been doing sleep medicine for over 20 years now. We've had our lab in Danvers for the last several years. And we provide a full-service sleep laboratory in terms of sleep testing and diagnostics in follow-up with our board-certified sleep physicians. I've been practicing at Beverly for approximately 30 years. I finished my training at the Massachusetts General Hospital in the early 80s. Came up here. I'm board certified in pulmonary disease and in sleep medicine as of 2004. We've been running the lab at the Danvers site with the help of SleepMed, which is a nationally known company that provides us with background in terms of technical assistance and quality assurance. They provide excellent technical support for our studies, and we provide excellent patient care. Some of the issues that we look at in terms of evaluating patients for sleep are daytime sleepiness, which is probably the main reason that we get referrals for the sleep clinic for evaluation. Unusual movements during sleep. We also see patients for nightmares or sleepwalking, sleep eating, which is an interesting phenomenon. I originally became involved in this because most of the patients who present to the sleep lab have sleep-disordered breathing. My background is in pulmonary disease. A lot of the treatment involved in treatment of sleep apnea involves respiratory devices that allow people to breathe a little bit more easily during sleep. In terms of the primary diagnosis of sleep apnea, what we're seeing is that people have many instances at night where they tend to fall asleep. As you go into the deeper stages of sleep, your breathing becomes more shallow and you can actually stop breathing. The end result is you can be in bed for 7, 8, or 9 hours. You can get 2, 3, or 4 hours of sleep and you end up with chronic sleep deprivation. The problem with that, obviously, is job performance, falling asleep at the wheel, loss of energy. I have quite a few patients who come in and think they're just getting old, when in fact they have pretty bad sleep apnea. Sleep apnea can be treated. There are a lot of opportunities. The technology is much better than it used to be even in the past several years. So it's not something that you have to live with. The initial issue in terms of sleep apnea is it has to be picked up. Many people during the day look and act pretty much the same as people who don't have sleep apnea. A lot of the physicians tend to be aware of sleep apnea, but if it's not something that you think of during a patient visit, it can be difficult to pick up. So the initial thing is to remind your physician that you do have trouble sleeping, snoring, sleep-related breathing abnormalities, and we can start the ball rolling from there.